Well, I have a master's in psychology, neuropsychology concentration. So I'm reading a little bit from the Mayo Clinic, and maybe I'll read some from kidney.org regarding chronic kidney disease, how kidneys function, things like that. MayoClinic.org. This is access today, um, Saturday. Make sure I get the date correct here for you. The 13th of February. So this is from the Mayo Clinic. Chronic kidney disease, symptoms and causes, diagnosis and treatment, doctors and departments, and then care at the Mayo Clinic. So this is not recommending one place to go to or another. It's for informational purposes only. What is kidney disease? An expert explains. Learn more from the kidney doctor, Andrew Bental, MD. Chronic kidney disease, also called chronic kidney failure, involves a gradual loss of kidney function. Your kidneys filter wastes and excess fluid from your body, which are then removed in your urine. Advanced chronic kidney disease can cause dangerous levels of fluid, electrolytes, and wastes to build up in your body. In the early stages of chronic kidney disease, you may have few signs or symptoms. You might not realize that you have kidney disease until the condition is advanced. Treatment for chronic kidney disease focuses on slowing the progression of kidney damage, usually by controlling the cause. But even controlling the cause might not keep kidney damage from progressing. Chronic kidney disease can also progress to end-stage kidney failure, which is fatal without artificial filtering, which is called dialysis or kidney transplant. There's a video here. It talks about how kidneys work. It's a 32-second video. I don't know if it's going to play here. So it's showing a woman's midsection, the bottom of, it doesn't, let's just say the bottom part of her chest. I don't know if this video is actually.
One of the important jobs of the kidneys is to clean the blood. As blood moves through the body, it picks up extra fluid, chemicals, and waste. The kidneys separate this material from the blood. It's carried out of the body in urine. If the kidneys are unable to do this, and the condition is untreated, serious health problems result, with eventual loss of life.
All right, so that's a video from the Mayo Clinic. It was in 2016. Basically talks about the basic functions of the kidneys to clear, filter wastes, and water from the body. Fluids. Symptoms, signs and symptoms of chronic kidney disease develop over time if the kidney damage progresses slowly. So loss of kidney function can cause a buildup of fluid or body wastes or electrolyte problems, depending on how severe it is. Loss of kidney can cause nausea, vomiting, loss of appetite, fatigue and weakness, sleep problems, urinating more or less, decreased mental sharpness, muscle cramps, swelling of the feet and ankles, dry itchy skin, high blood pressure, hypertension, that's difficult to control, shortness of breath, if fluids build up in the lungs, chest pain if fluids build up around the lining of the heart. Signs and symptoms of kidney disease are often nonspecific. This means they can also be caused by other illnesses. Because your kidneys are able to make up for loss of function, you might not develop signs and symptoms until irreversible damage has occurred. When you see a doctor, make an appointment with your doctor if you have signs or symptoms of kidney disease. Early detection might help prevent kidney disease from progressing to kidney failure. If you have a medical condition that increases your risk of kidney disease, i.e. things like, from the top of my head, what I remember is high blood pressure, your doctor may monitor your blood pressure and kidney function with urine and blood tests during office visits. So that's typically the way that they do it, urine and blood tests. They measure something called glomerular filtration rate. That's the GFR number. It's called EGFR for estimated GFR. That's what you see on your blood work. And um, according to kidney.org, normal kidney functioning is 90 or above. Um, when it becomes diagnosed as chronic kidney disease, that's 60 or below for the GFR, the eGFR. They have a number that is specifically for African Americans or Black people, and then they have a number that is specifically for people who are not Black. Um, um, so eGFR if Black and eGFR if not African American. And then there's age specific norms, um, which, if basically if you're in the ballpark within the age specific norm, then, the person, it might not be a big problem, basically, but it's something to monitor, is what they kind of have. So people that are 75 years or older, the age specific norm is like 70 or above, right? So 60, chronic kidney, 60 or lower, chronic kidney disease. Um, for someone who's 70 or older, or around that kind of sort of, you want to not quote me on that, but look up on kidney.org. Um, Basically, 70 or above is an a is a is a is is basically an average for those people. So most people that are 70 years or older have a GFR of around 70, or 75 or older have a GFR around 70. But um, normal kidney functioning is 90 or above. So um, that's something also. Um, I know that I read that sleep can also affect kidney functioning, blood pressure, drinking enough fluids, um, things like that can affect. Diuretics can affect kidneys as well. And this is generally known information within the field. Causes: chronic kidney disease occurs when a disease or condition impairs kidney functioning, causing kidney damage to worsen over several months or years. Diseases and conditions that cause chronic kidney disease include, type 1, type 2 diabetes, high blood pressure, glomerulonephritis, nephritis, nephritis, glomerulonephritis, and inflammation of the kidneys, filtering units, the glomeruli, interstitial nephritis, and inflammation of the kidney tubules and surrounding structures, polycystic kidney diseases or other inherited kidney diseases, prolonged obstruction of the urinary tract from conditions such as enlarged prostate, kidney stones, and some cancers, vesicular reflux, a condition that causes urine to back up into your kidneys, recurrent kidney function, also called uh, pyelon, pyelonephritis. Pyelonephritis. So that's a recurrent kidney infection. Pyelonephritis. Risk factors that increase the risk of chronic kidney disease include diabetes, high blood pressure, heart or cardiovascular disease, smoking, obesity, being Black, Native American, or Asian American, family history of kidney disease, abnormal kidney structure, older age, frequent use of medications that can damage the kidneys. Complications: chronic kidney disease can affect almost every part of your body. Potential complications include fluid retention, which could lead to swelling in your arms and legs, high blood pressure or fluid in your lungs, pulmonary edema. Yeah, it's pulmonary edema. A sudden rise in potassium levels in your blood, hyperkalemia. Potassium is that K plus signal, which could impair your heart's function and can be life-threatening. Potassium. plus, okay, I don't know. Anemia. So um, basically, not having anemia can be caused from low iron or iron deficiency, heart disease, weak bones, and an increased risk of bone fractures, decreased sex drive, erectile dysfunction, or reduced fertility, damage to your central nervous system, which can cause difficulty concentrating, personality changes or seizures, decreased immune response, which makes you more vulnerable to infection, pericarditis, an inflammation of the sac-like membrane that envelopes your heart, pericardium. Uh, I want to say that um, I just learned that Bob Saget passed away because he apparently hit his head in a hotel in Orlando, um, and they found him the next day in his hotel. This is from CNN as of 2 hours ago. His family um, updated people about what occurred, and this occurred, I think, about a month ago. So um, I think it's generally advised if if someone has he had a skull fracture and he died from a subdural hematoma, which is basically bruising on the inside of the brain. He also had microbleeds, so I mean he also had bleeds, small bleeds in the brain. So they found him the next morning in his bed, dead. So I think the general accepted advice is if you ever hit your head, go get it checked. He went back to sleep and he passed away. Unfortunately, somebody that everybody revered and admired as somebody who taught family values or was on an amazing show. That's how I remember him, and just an overall funny and good person. Um, it also said that he had um, heart. 95% of the left side of his heart was 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 occluded or something. Uh, Also, I mean, from what I saw, his last picture, he looked a little. Um, I mean, he looked a lot heavier than he typically did on his TV shows. So he probably had several things going on. But anyway, heart goes out to him and his family and everyone who loved him as an actor or a family member or a friend. Um, but yeah, that's just general advice to go get checked. Um, he also was taking, or he also had COVID-19 at the time. They found out, and was taking some medications um, that could be prescribed for either sleep or as an SSRI for antidepressant. But um, it's just sad that he's gone. But anyway, the general advice is um, particularly from somebody who studied neuropsychology, um, and not only for me, but general advice in the field of medicine is to go get checked if you hit your head, because he thought nothing of it, and he ended up having a skull fracture, so he died. Back to this: pregnancy complications that carry risks for the mother and the developing fetus, irreversible damage to your kidneys, end-stage kidney disease, eventually requiring either dialysis or kidney transplant for survival. Prevention: to reduce your risk of developing kidney disease, follow instructions on the over-the-counter medications. When using non-prescription pain relievers such as aspirin, ibuprofen, Advil, Motrin IB, and others, and acetaminophen, Tylenol, and others, follow the instructions on the package. Taking too many pain relievers for a long time could lead to kidney damage. So I think that it's good to ask your doctor, your medical doctor, a specialist, your pharmacist about any of those specific problems or potential problems in the future or interaction effects or how it affects your kidney and your body as well. Or if there's other safer alternatives that you could switch to regarding pain medication as well over a certain period of time. That's the understanding that I've gathered over time because over time, one type of medication could have an effect, and then you have to be switched to another one because you person may be habituated or it may be having an effect on a certain part of the body. And then over time, that medication may continue to work or may not, or may have an effect. So that's why it's a lot of work, especially if somebody is in pain or has pain medications. It takes work to actually figure out what's going on, problem solve, and find solutions. Um, you know, that's the best of what I know so far. And you probably want to go to a specialist and you know ask them about all the risks, um, and or pain management specialists and things like that. But because of the heat that many doctors, medical doctors, have gotten because of risks that are involved with controlled substances specifically, really strong pain medications. Um, I, it's come to my understanding that there could be a very touch and go subject, um, a subject that's riddled with controversy or even bias. Um, and I was reading some testimonials online about people that have terrible situations, and some people that are completely treated with their recommended or prescribed medication, and some other people that have terrible situations that occur or interaction effects, and other people that have been refused treatment um, because of different policies that have been put forth within the last 10 years um, because so many people have um, either abused the medications or misused the medications. But it's unfortunate because a case by case basis and case by case analysis and um, engaging in the hard clinical decision making and with trying out a treatment, seeing what's affected, doing the tests, asking about the symptoms, trying something different, asking about the symptoms, doing a different test to find out what works. That process is a long, arduous, and hard process. And many people, it's. Uh, I'd say you're blessed, lucky if you could find a medical doctor, a specialist, a psychiatrist, a pain management specialist that will engage in that with you. That is not uh, is um, doesn't endorse cognitive laziness. So you want to find somebody who's there for you, who's going to make sure that you have the maximum benefit and the least amount of risks, what to do in the event, to explain everything to you, um, and all the potential interaction effects, because you could take one medication and interact with, let's say, things like grapefruit juice, or you could take one medication and then interact with another medication, or especially if it's a new medication that came out in the last 10 years, those are the ones that sometimes get recalled. One third of them do. Um, and you always want to be on the lookout of those things. And it could be tiring, it could be exhausting, and it could be just thought of as a burden at sometimes. But, this is the state of where people are at with pain management. Some people report they feel great. Some people report that they felt like they have been let down by their doctor. Some people have reported that they've had complications and had to slowly get off of the medication, wean off, titrate down. These are all the things that the doctor should talk to you about. If they're a reasonable and prudent doctor that cares about your benefit and risk. And some people have gotten off, and I'm not saying this is you or anyone else, um, but some people have gotten off and sadly committed suicide. Um, those are the very real complications with actual pain management and pain medication. So um, that's just a little segue because we were talking about over the counter medications and pain medications as well. But specifically, that's for prescription medications and things like that. But not all medications will that will occur in you, and not everybody is going to have a problem with that. So this is, once again, for information purposes only. This is something you could talk to your doctor about, a specialist about, a clinical pharmacologist or a clinical um, psychiatrist about, um, and they may be able to assist you. But it's not it's not like everybody does that. It's not like everybody tries something, sees if it's working, what effect it's having, tries something different if it's having a negative effect, and then switching it if it's no longer working for them anymore, testing out if that works, asking about the symptoms to see if it relieves the pain, what natural remedies, what other um, um, cognitive behavioral therapy or